Welcome to Know Your Health. It is Monday, where we just seek to know all things that are actually connected to our health, how we are doing, the conditions that are actually affecting us, and many other issues that we usually discuss here in this program. And of course, today we also have an issue that a lot of people actually ignore it. People are ignorant of it, they don't want to know more about it, but we've come to realize that it is a situation that is affecting our society, and therefore we should be having a discussion about it, and that is medicine safety. You know, when you buy your medicine, you usually find it in a box, and maybe they have told you store out of reach of children, I don't know, store it in certain temperature and everything, and you're given the instructions on how to use it, what the medicine is for. But nowadays, you know, we self-medicate a lot. The other time we were talking about antimicrobial resistance, and that is a condition where your body just develops resistance to a certain medication, a certain type of medication, because you've abused that medication before. So we're moving on to talk about medicine safety, and with me in studio we have a specialist pharmacist, Dr. Mula Zaituni, and from the Kitale County Referral Hospital. I'll give her a chance to talk to you and just say hi.
Hello viewers, my name is Dr. Zaituni Akaderoit Mula. I'm a specialist pharmacist from Kitale County Hospital. I specialize in pharmacovigilance and pharmacoepidemiology, that is basically medication safety and research. I do round in the pediatrics ward in the Kitale County Hospital, and I would like to talk to you today about medication safety. I know that we usually use a lot of medications, or either over the counter, you just went to the pharmacy and you bought something, or when you get to the hospital, when you have fallen sick, your doctor may have prescribed to you a medication, whether it's an antibiotic or otherwise, or maybe you're admitted in the hospital wards, you also may end up using medication, or maybe you usually use vitamins and other medicine-related products outside the healthcare setting. So that's what we want to talk about today.
Okay, so just starting off, what is medicine safety? Because that is our topic today.
Yes, so medication safety is the same as pharmacovigilance. This is where we just collect and monitor information as related to medication use and the side effects that are usually associated with the use of medication. Basically, medicines are usually safe. They're usually safe when you use them in the right dose as prescribed by your doctor, but sometimes you can develop some side effects which are unintended. You take a drug for a certain condition which your doctor feels that the medication is right for, but after a short while you develop some side effects that the doctor had not thought about. These side effects can be known, the ones that we have known through the clinical trials which were conducted when the medication was being developed, or there can be some rare reactions that may crop up. For example, some allergic reactions. Some people generally have allergies to certain medication. For example, someone may be allergic to penicillins and also maybe Septrin, maybe the cephalosporins. For example, we have seen someone who develops rashes after using a penicillin, or someone may lose a bit of their skin from using the Septrin.
Mm-hmm.
So this is something that has been very well documented for some of the medications, but for others, there may be some new reactions which were not initially documented. These reactions may be related to the age of the patient, maybe the disease condition that they have, or some other physiological factors that are unique to the patient.
Okay.
Yes.
But now, why monitor drug reactions?
So we usually monitor drug reactions in this sense when we are doing the clinical trials to determine the safety and efficacy of a medication. We usually use a population that is healthy and most likely adult population, and we leave out some populations such as pregnant women, pediatric patients, or elderly patients. So when we get the drug into the market, and usually the clinical trial runs for a very short time, but when we get into the market, the medicine is used by a larger population of people, including the ones which were excluded in the clinical trials. So we tend to observe some new reactions which were not noted during the clinical trials. And also some side effects may take a longer time period before they manifest themselves. So it's very important that we do monitor these adverse drug reactions.
Okay, someone else might not be understanding what is a drug reaction. Maybe you can just mention some examples.
Yes.
Of drug reactions.
So a drug reaction is just any reaction that is unintended. Like for example, when your doctor prescribed amoxicillin for you, maybe for the management of pneumonia, they would expect that you would get cured of this pneumonia. But someone else may develop a reaction such as a rash, or maybe very suddenly you develop hypotension and you faint. That is not something that the doctor had intended when they were prescribing that medication for you. So we would qualify it as an adverse drug reaction, yes.
Okay, I'm saying that because we've had a lot of medication. When you read that leaflet, a lot of medications come with leaflets, and they would tell you that some side effects are maybe nausea, headaches, and things like that, maybe exhaustion, and things like that. And maybe someone atapata hizo vitu and they think that it is just normal, so let me just stay with it. Or maybe someone might think it is another condition na anaenda kuongezea dawa ingine juu. So I don't know what you can say about that.
So basically, your pharmacist should be able to advise you on the adverse drug reactions when you're taking the medication from the pharmacy. Some of the reactions are very well documented from the clinical trials that were conducted. Say the headaches, the nausea and vomiting. Some of it may be up to a manageable level. So we usually, at the pharmacy, we usually measure the risk-benefit ratio. If this drug is going to benefit you more than it would harm you, then we would generally just give you the medication, but with some instructions to monitor some of the side effects. If the side effects are a bit unmanageable, for example, if you get nausea and vomiting that is quite severe, naturally the pharmacist or your doctor should be able to change that medication for you. But if the nausea and vomiting is just to a slight extent, your pharmacist would advise you that this drug may cause A, B, C, D. Please just be on the lookout, but do not panic. But some other times they will tell you if the reaction is severe and life-threatening, you should just come back to hospital for further management.
And so what happens? Because the last time we talked, we had talked about conducting tests when we were talking about antimicrobial resistance. We said that they can do a test to ascertain that that drug is going to work for you. Is the same done to ensure that maybe this person will not react with this drug before you give them that medication?
Usually it's very difficult to know whether a person is going to react or not, but some of the drugs already have some documented data, and some tests have been developed to determine whether someone is going to have a reaction against a certain medication. For example, we have a skin test for penicillin, where they just do a slight snip on your skin just to see whether your body will show some sort of reaction. This is why we have specialist pharmacists. For example, you have clinical pharmacists who basically monitor your treatment, and then you have pharmacovigilance specialists such as myself, whose work is to monitor your reaction to treatment. So ideally, anyone who is using medication should have access to a pharmacovigilance specialist so that they are able to be given some advice on the drug reactions that may occur.
Well, once those drugs are on the market, you said that clinical trials are conducted before a drug is approved to be used by human beings. And once that is done, you release the drug to the market. But you might find out that the drug that you released is actually affecting some people. So what is done thereafter, after the drug has already been released?
So in Kenya we have a regulatory body that is called the Pharmacy and Poisons Board. So any product that comes into the market is registered with the Pharmacy and Poisons Board, and the company is expected to conduct post-marketing surveillance in conjunction with the Pharmacy and Poisons Board, just to make sure that the drug is not affecting people negatively in the population. This is just so that they can collect a little bit more data on the drug while it's being used in the population. This is why sometimes you would hear some drugs have been recalled, like recently, maybe a year or two ago, the drug by the name ranitidine was called back because it was affecting some people in a negative way, but it had been in the market for quite some time. So basically, post-marketing surveillance is quite important in identifying adverse drug reactions.
And is that being done?
Yes, it's actively being done. I think that is one of the requirements when you're trying to register your product in the Kenyan market. The Pharmacy and Poisons Board would expect that the company would conduct post-marketing surveillance.
Okay, we are talking about medication safety, and we are with Dr. Zaituni Mula. Remember, you can send in your questions at 0746780588. You can do that on WhatsApp as well, the same number. You can go to our Facebook page at Imani Television, and you can send there your question. Of course, you can also go to my personal page at Sylvia Nyongesa and send there your concerns, your comments, and anything that you wish to know about medication safety. We are taking a break, but we will be back with more about safety measures when using medication.